with Parkinson's disease dementia that some dementia residents and dementia units experience. There's three classic symptoms. Firstly, the well-known tremor, the pill-rolling tremor. Then there's the slowness of movement, slowness in walking, and then the stiffness or the rigidity. With rigidity, it can either be lead pipe rigidity, where there's stiffness and resistance throughout the whole movement, or it can be cogwheel rigidity, where it's intermittent and jerky throughout the movement. So it's difficult indeed for dementia residents. So difficult, isn't it? Having Parkinson's and dementia and having to cope with both. But as with everything to do with dementia, there's always something positive you can do. So with Parkinson's dementia, in the previous video I've talked about walking and how to help with gait and walking, but there are other things that you can do to help. So firstly, the stiffness of the muscles. They can become very painful because they're tense and they're tight and they're stiff. Now, as I mentioned in the previous video as well, it's important to be able to do full range of motion exercises, shoulders, upper arms, legs, bending the knee to the hip and straightening to be able to get and release the muscles, joints and tendons. But also, as well as that, there's other things you can do, physiotherapy type techniques. Firstly, heat. Heat is a wonderful thing because when we get cold, everything becomes stiff, sore and tense. And especially if you are already have stiff, tight, tense muscles, the cold gives us more pain, more tension, more tightness. So you want to release the pain, release the tension, release the tightness, get the blood flow going. So hot packs and heat is very good. I mean, unfortunately in dementia units, you can't have electric blankets. If the person's at home, of course they can, but in dementia units, that is not the case because of risks. So heat, wheat bags, heat, and massage. Massage is a really good thing. You know, neck massage and get into all those little knots and tightness and put on nice cream, and it has a very relaxing effect, and it also is very effective, releasing the tension, releasing the trigger points, releasing the tense muscles. Make sure it's at a level that the person can tolerate. If it's an elderly person, the technique has to be a lot lighter than if you're a younger person. But it is important to get into the tissue enough that you're releasing the tension, practically being effective. You don't want to just do smooth, light, superficial massage. I mean, that's not going to do anything. You do have to get into those muscles, release the tension and tightness. Heat packs first, massage second, and stretches and exercises third. That will be just such a good routine for a person that's having problems with dementia, with Parkinson's. Now, also to recognize that it can be very tiring, very tiring. Pain is tiring, and Parkinson's can be painful with the muscles tensing up and tightening. So bed rest and relaxation is important, so make sure that the person gets enough of that. Positioning them comfortably in bed is another thing. Making, for example, if they're side lying, getting the feather pillow packed around their neck and head so that they can be comfortable. Maybe a pillow under their upper arm and a pillow under their knees. Just position them and ask them as you're positioning them, are they comfortable with this particular position? Because often what happens, it's one stiff, inflexible rubber pillow for their head. That's it in the bed. Oh, how can you sleep with that? No flexibility. And you need that flexibility to be able to pack the pillow around the head, for example, and also under the knees if they need that, or the arms if they're on side lying. And it's a matter of working with the person, and they'll tell you when they are in their most comfortable position. So heat, relaxation, positioning, feather pillows, encouraging, supporting, and, congratulating the dementia resident, encouraging them for the efforts that they're making just to be able to get through a day having all these symptoms and things, such courage. But encouragement helps our courage. It helps buoy us up So be encouraging, be enthusiastic, be positive, all of those wonderful things. And it helps us get that energy going to give us the stamina to be able to work with this complicated condition. We know it's complicated, but that's why I'm breaking it down to positive modules, both in the books, Residents Voice, Residents Rise, and the videos, so that it's manageable chunks for us to be able to help, manageable chunks for the person that's got dementia to be able to, you know, cope with it and make the effort to work with it, and especially for the carer and the carers. It has to be manageable, practical, positive chunks that we can implement to help both the care of the resident, their cognition, and the all-round benefiting the person without wearing out the carer. That's very important. So if I'm enthused as a carer with the help I'm giving, and maybe the extra help I'm doing as these videos pertain to, and I can keep up that energy and interest being a big factor, then you find everything starts flowing and progressing nicely. So thank you for your support, likes, support, and comments. Please subscribe. Thank you.